A health emergency comes to an end. The World Health Organization made a major decision about a virus that changed lives around the world.
With this post to Twitter just hours ago, they announced the COVID-19 global health emergency has ended.
It's certainly nothing that anybody anticipates encountering in their career. However, I think we managed pretty well given the circumstances that we were faced with.
And now that the pandemic is officially over, we're hearing from community members, including business owners, about how the COVID-19 pandemic has impacted their lives.
Yeah, and as we learn how protocol is changing with this new declaration.
Much like the rest of the world, local universities and businesses had to adjust when the pandemic started.
ABC 27's Ariel Schiller spoke with some of the people about how they handled it and how life looks different post-pandemic.
I spoke with FAMU and Lofty Pursuits about how things have changed for them. The biggest takeaway is that now they're just learning to deal with COVID like any other illness.
When the pandemic officially started in March of 2020, everything changed. Greg Cohen, owner of Lofty Pursuits in Tallahassee, paid attention to international news and prepared for the worst. One of the major changes he made early on was doing away with tipped wages and paying all of his employees minimum wage.
I knew tips weren't going to be what it was. I basically gave all my low-end employees raises. I made it clear that they weren't going to get fired. I made sure they knew that if they got sick, they were still going to be paid because I didn't want them to come in and get the rest of us sick.
Restaurants weren't the only ones having to make changes. Universities like Florida A&M University also had to adjust. Tanya Tatum, Director of Student Health Services, says a lot of changes have happened over the last few years.
We have gone from being on lockdown for a short period of time to doing classes virtually to we actually reopened our campus fairly early, gave students the option, virtual or whatever, but then probably a semester later, everything was back on track.
Cohen says they've kept some of the practices from the pandemic in place. They expanded the dinner service, which still exists on Friday and Saturday nights.
Some of the things that we did during the pandemic we're continuing to do. We turned back the clock on a lot of them, and we're still trying to catch up.
While some businesses struggled, Cohen says his managed to gain more customers. Post-pandemic, they're still doing well because he kept that minimum wage pay in place.
We haven't had trouble finding employees, it seems, as bad as some of the other people because we're paying more.
For universities, things are getting back to normal, but Tatum says they're still seeing COVID cases. Now they'll include it in what they test for when someone comes in with symptoms of an upper respiratory illness.
Students may come in, they may be symptomatic. You know, if you have upper respiratory symptoms, that'll be one of the things we'll test for. You know, we test for flu, strep, COVID. You know, so our protocols will change a little bit.
Cohen says he's grateful his business thrived during the pandemic and that people wanted to support him.
We make people happy by what we do, so we continued to do it. We were flexible, we were on our toes, we changed the rules all the time. And because of this, we stayed in business.
Tatum says the biggest hurdle now is re-educating people about how to deal with COVID now that the pandemic is over. Reporting live in Tallahassee, Ariel Schiller, ABC 27.
Checking with the Florida Department of Health, they say as many as 1 in 4 third graders has untreated tooth decay in the state. Sable Palm Elementary is trying to fix that problem with help from Bond Community Health Center.
Yeah, today they unveiled their new Smile Connection at Sable Palm. The new clinic will expand on the efforts of the health center's mobile unit in the community.
The need is great, the demand is great. We really wanted to expand what we were able to do to help the students here and also then make it available to the surrounding community.
The clinic will initially cater to students of the elementary school, but will eventually service members of the immediate community.